Yeah, so I'm doing my video presentation on schizophrenia. I found this to be a pretty interesting mental illness to talk about today mainly because I know a few friends of mine who have been diagnosed with schizophrenia before, and I just wanted to look into it some more and maybe understand it on a different level than I did before. So here we go. What is schizophrenia? Schizophrenia is a chronic psychological disorder that affects a person's thinking, feeling, and behavior. It is a very complex disorder in that a patient must display certain behavior criteria for a certain specific amount of time. So yeah, so you can't just really be diagnosed with schizophrenia for any type of random psychotic disorder or any type of psychosis that you may be experiencing. You kind of have to display certain behavioral criteria, meaning that you might have to say show like different episodes of psychosis for 5 months, and then after that you can be diagnosed further. But along with that, there's also other things that go into diagnosing which type of schizophrenia that you might have. So yeah, I will continue on. Types of schizophrenia. So this is pretty interesting. There are four main types of it, and schizophrenia can take different forms in different people. In order to treat everyone, the symptoms can be narrowed down into four main types of schizophrenia. Paranoid schizophrenia is usually the one that most people hear about the most often, I would probably say. This is where a person may experience extreme paranoia and even act on it. They also seem to experience little pleasure in life, and I guess that's just one of those things that goes along with being paranoid all the time. These kind of people, they would think somebody's watching them. They would think somebody's following them. They've even been known to like go up to a door of the FBI headquarters and ask why they're watching this individual, even though they clearly aren't. The next type would be catatonic schizophrenia. This is where the person shuts down emotionally, mentally, and physically. They appear to be paralyzed and lack all drive to eat, drink, or even urinate. So this one, I would assume, is probably less common than paranoid schizophrenia. This is where a person basically just has no will to continue living or doing things that a regular person might do. And yeah, that's a pretty debilitating one. Undifferentiated schizophrenia. This is when a person shows various vague symptoms, little talking or expression, and may not bother to bathe or change clothes. This one's interesting. This one is where a person isn't totally shut down as with catatonic schizophrenia, but rather the person shows vague symptoms, or say, rather than experiencing extreme depression, they just experience vague depression, and they just don't want to talk to the people helping them or express what's actually going on. And along with that, depression and other symptoms that come along with undifferentiated schizophrenia may cause somebody to not bother to bathe or change their clothes. Excuse me. Schizoaffective disorder. So this one is I guess, a branch of schizophrenia where a person may experience delusions or other symptoms of schizophrenia with the addition of one or more symptoms of a mood disorder, depression, or mania. So this is where a person can experience the delusions, the hallucinations, and even the other things that go along with being a schizophrenic. But in addition to that, they also experience one or more symptoms of a mood disorder like depression or mania. I I don't know how to further elaborate into this completely, but from what I was reading, it was just basically where it's not like full on schizophrenic, where a person may require hospitalization, but rather just one where the conditions are a little bit, they're there enough to consider it a disorder, but not quite enough to chalk it up to the full fledged thing. Symptoms. So this is where people start to get misconceptions and other things along with that. So the symptoms of schizophrenia vary greatly from patient to patient. Some of the more common symptoms include hallucinations, delusions, thought disorders, reduced motivation, and diminished feelings of pleasure in everyday life. So with this one, people with schizophrenia, like we said before, there are different types of schizophrenia, and people with those different types may not feel all of these things. These are just a list of some of the more common symptoms. So hallucinations, this would include seeing and hearing voices, or seeing things that really aren't there at all. So you may see a person that is deceased or isn't there. You may see visions of creatures or other things that are just scary, or bugs or other things like that. Or you may hear voices, like people are whispering to you, voices in your head and stuff like that. So the next most common symptom would be delusions, firmly held beliefs that are not supported by facts. So this would include things that are like, I don't know, they may believe that, say, the FBI is chasing them, or they may believe that they're going to die soon if they go outside, or if they do this, something terrible is going to happen. Things along those sort of lines. Thought disorders, so this would be unusual thinking or disorganized speech. So this may be somebody who's just thinking in a very weird manner and just, excuse me, that was my dog. So this could be somebody just thinking in ways that are just illogical, or disorganized speech, or dyslexic, even characteristics, things that go along with thought disorders. Reduced motivation. This is when a person may have a difficult time planning, starting, and participating in activities. This is pretty self-explanatory. This is just when a person has little motivation to do the things that would have normally made them happy. And then lastly, we have diminished feelings of pleasure in everyday life. Onset. So yeah, this is the times and criteria that schizophrenia is usually diagnosed under. So schizophrenia is usually diagnosed in the late teens to early 30s, and typically occurs earlier in males than in females. So I think from what I read, it was in males it typically can occur between the ages of 15 and 30, whereas for females it's typically between like 23 and 40 or something along those lines. And yeah, so the males are more vulnerable to be diagnosed with schizophrenia earlier in their life. Diagnosis typically occurs after the first period of psychosis, which is often when the first symptoms are shown. So when somebody has like an episode of psychosis and they go to the hospital and they, get checked over by doctors and they have people look at them and talk to them and all of that, if they can deem that experience as an episode of psychosis, that would be like when they start thinking like, okay, maybe we should start checking the criteria to diagnose this person with schizophrenia. Even before the first episode, however, adolescents will sometimes experience gradual changes in thinking, mood, and social functioning, usually around mid-adolescence. So this one I found especially interesting. So this would be saying that children, before they're even fully developed, can sometimes like experience gradual changes in their thinking, mood, and functioning, in the ways that would make somebody concerned about schizophrenia. So this makes me wonder if we could find these signs and identify these problems early on in the childhood, would it like probably aid in further diagnosing these people correctly in adulthood? And then the last one is, while not common at all, it is possible for children to be diagnosed with schizophrenia. This is pretty rare though. When I was reading it, I did see that it's very uncommon for a younger child, somebody under the age of 15, to be diagnosed with schizophrenia. What causes schizophrenia? This one is another one I found very interesting. So genetics. Schizophrenia can run in families, but there's no solid evidence of it being hereditary. Some genetic studies have strongly suggested that many different genes increase the risk of schizophrenia, although no one gene causes the disorder by itself. So this is meaning that there are different genes that many schizophrenic people have shared, and scientists have theorized that maybe those genes increase the risk. However, there is no one single gene that actually causes schizophrenia by itself. The next cause would be the environment. Scientists have also made connections between a person's living environment during adolescence and the onset of schizophrenia. So these factors include poverty, stressful living conditions, sanitation, and nutritional problems. So this is where if the child or a young person grows up in a very difficult place or difficult environment, it may increase the risk of mental issues in the future. Brain structure and function. These factors can include the way regions of the brain are connected, the presence of neurotransmitters, and even the size of different components inside the brain. So this would be just how the brain actually developed, like what neurotransmitters such as dopamine and serotonin and oxytocin are there in your brain to do the specific functions they're doing now. And everybody is different. So some people may just be born more inclined to contract schizophrenia than others. This topic is one that really hits pretty close to home for me. Substance-induced psychosis. So when I was younger, my brother told me about how he had a friend in high school who he used to do a lot of LSD or acid, and one day, like I've known this kid for my entire life. He was our neighbor, and we would hang out as kids a lot. And my brother came home one day and just told me, like, Daniel, he basically overdosed on LSD and just took so much of it that now, like, he's in this state of constant psychosis. Like, he's always tripping almost, like, on this drug. I found that to be just the most horrifying thing ever. Like, he was a regular dude, a regular person before, and then because of these drugs that he ingested, he was like borderline schizophrenic as a result of that. So substance abuse-induced psychosis. Substance-induced psychosis is a medical term used to describe episodes of psychosis as a result of using/abusing psychoactive substances such as LSD, cocaine, or MDMA. People with underlying mental health issues are much more likely to experience substance-induced psychosis, although even people with no existing mental health issues can still develop it after taking a large amount of drug. So most people who develop substance-induced psychosis are people with underlying mental health issues that whatever effect of the drug just substantiated a lot. But the scarier thing is that people who have no mental health issues at all, you could be a normal person on your way to a life of success and going down a path that you want to go down, and then all because of one mistake, you can find yourself in a position where you're schizophrenic. And many people who experience drug-induced psychosis will later transition to a diagnosis of schizophrenia. This means that a normal person who takes too much of certain drugs can become schizophrenic. That's a horrifying concept to me. And I've now known two people, my brother's friend Daniel from when I was a younger kid, and a man named Rob who I just recently met at one of my music venues. Treatment. So schizophrenia requires lifelong treatment even after the symptoms have subsided. And basically that just means that medication and other preventative measures, maybe therapy, may be necessary even long after the actual symptoms have receded. Medication is one of the first treatments given to patients with schizophrenia. The primary medications are antipsychotics. These are thought to treat the condition by effectively lessening certain neurotransmitters in the brain, like dopamine. This one I find sort of controversial, and I might not even agree with it entirely. So their idea here is this person has psychotic episodes because of imbalances with brain chemicals. And so to treat that, we just give them an antipsychotic medication every day that suppresses these neurotransmitters completely. Maybe not completely, but I mean, to any extent, I think raises some moral questions. And it's like that could turn somebody catatonic, and that to me would just be horrible. That's not to say that these drugs aren't effective, but I just find that medicating somebody heavily who has a mental disorder is more imprisoning them in their own mind than treatment. So hospitalization. During times of severe symptoms, hospitalization may be necessary to ensure proper nutrition and hygiene. And yeah, that's pretty obvious. I mean, if somebody's severely schizophrenic to the point where 100% of the time they're experiencing severe symptoms, hospitalization for the long term may be necessary to ensure their own safety. So if a person's always, contemplating hurting themselves, or if they don't eat very well, if they don't take care of themselves, or forget to take their medicine very often, then hospitalization may be a better option to make sure that person stays safe. And then lastly, we have psychosocial intervention, sorry. Once psychosis recedes, psychological therapy may be administered along with medication to help patients cope with their condition. So after these these symptoms and the psychosis and other severe symptoms recede mostly as a result of the treatment. Other psychological therapy may be administered, and so that means like regular psychologists would come and speak with you and talk to you about things. You may have social exercises where you get the opportunity to talk to other people and actually interact with people like a regular person would. And I think this is probably the most effective method of treatment that is administered to schizophrenic patients. I mean, I don't know how effective it actually is. I'm sure the medication is much more effective, but I think that if this works, there must be a way to do it in such that a person can actually recover. Okay, so positive. So yes, there are a couple of positive outcomes to being diagnosed with schizophrenia. I mean, I guess it wouldn't be considered positive to a person like you or me who is not schizophrenic, but there is a bright side to everything, I guess. And so this mainly is people with schizophrenia can sometimes learn to live normal lives and even work everyday jobs. I mean, there are places for people who have mental disorders that are severe, where they can go and work and they can have like people to be around other people who have mental disorders and illnesses. I mean, they can be in their own community and lead a happy life that way. And I think that's definitely something to give people who are diagnosed hope, and that would be a positive outcome for me. And mostly for me, this is another thing I found quite interesting. As a result of their diagnosis, some patients find they have developed new skills. This can include painting, music, writing, sculpting, and many other art forms. Often the product of these new skills is quite abstract due to their new neurological changes and can offer the consumer a glimpse into the mind of a schizophrenic. This I find extremely interesting. So schizophrenic people, their mind has been changed in a way that we could never fathom. We can never understand exactly what's going on inside their head. And the things that they might see, even the hallucinations or the scarier things, I mean, some people have developed like amazing abilities, like almost savant level abilities to illustrate or to make music about or to sculpt what is actually happening inside their mind. And I think that art is some of the most beautiful that I've seen. And I think a lot of other people agree with that. It's just very, very striking to see what actually comes out of the mind of a schizophrenic patient. And this is the conclusion. And pretty much I'm at 17 minutes now, so it's a lot over. But schizophrenia is surely one of the most severe and devastating mental illnesses. People who have been diagnosed with it usually lose their opportunity to live a happy and free life. But perhaps one day we'll be able to advance to find a cure to it. And that is one thing I've been thinking about throughout this project, is that maybe one day we'll actually come up with a treatment for schizophrenia that can just end it, right then and there, and have a person be able to go back to living their normal lives and being happy again with their families and whatnot. So, but yeah, until then, we will just continue educating ourselves about it and just knowing as much as we can and being compassionate towards people who have it. Well, that's about it. And I think I'm going to stop my presentation now. I hope this is enough. Thank you and have a good night.